The Network Health Check is a summary report which is based on a big survey, or a huge survey, which is completed by all the partner networks. And it's used by Viva to help support partner networks to run their programs and achieve their sustainability. And it's also to understand our current global trends and to identify global development needs. So among other things, the NHC looks at all the programs that have been run, and it looks at the sustainability levels of the networks and how that can be improved. Excuse me, I'm just going to drink. So overall, the 2022 NHC showed that Viva partner networks are currently work in 27 countries with over 3 million children through the work of 5,400 churches and organisations. So there are currently 42 partner networks, and their locations can be seen on the map. And then this year, we've got 3 new networks who've joined Viva, and they're located in the Dominican Republic, Mexico, and India. So the NHC report showed us this year that child protection and safeguarding still remain the key focus areas of the networks, with 90% of partner networks delivering training in this area. And on a structural level, network engagement with decision makers continues to grow. And in fact, 44 policies and laws were influenced in the last year, which will have an effect on millions of children, which is great news. This year, all of Viva partner networks ran programs from what we call our 4 key drivers. So these are ways in which we classify different activities which are run by the network. And the 4 key drivers are connecting, capacity building, collective action, and citywide influence. So to give a bit more detail about that, connecting refers to inspiring local churches and organisations to work together for a shared vision for children. And in total, at least 180 connecting events were held by the network this year, which included things like regular prayer meetings. So these are things that bring people together. Capacity building refers to increasing the capacity of the networks and the network members. And that's through training and learning how to improve care for children. So this year, 168 capacity building programs were run by the networks. However, this is the second year we've actually seen a drop in the reach of child protection training. So that's something we can pray for later on. Collective action is about mobilising churches and organisations to work together to meet children's needs on a deeper level than any organisation could do on its own. So for an example of collective action this year is that 57,000 children received physical aid through an emergency response, and that was kind of mainly in response to COVID. And finally, citywide influence refers to addressing negative attitudes and behaviours towards children and engaging with decision makers. And this year, over 1.5 million children benefited from citywide influence programmes, which is an increase from last year. So the NHC report also checks the sustainability levels of the network. And the sustainability benchmark covers 10 areas, criteria, and it looks at things like governance of the network, policies, staff structures, and also the network's strategic planning and its ability to find funding. So this year, 4 networks scored the top score of 100 in sustainability for the first time. And overall, the sustainability scores have consistently improved over the past 4 years. So that's a brief overview of what the report covers. So following on from last year's NHC, we're now trying to act on what we've learned we're developing online training for child protection of churches and organisations to help them to write policies, and we hope that that will improve the scope of the child protection of organisations and churches that receive child protection training. We've also going to be encouraging people to hold individual meetings with members to keep checking and keep them engaged, as well as visiting individual new churches and organisations to invite them to join the networks. And we're also wanting to support the networks to develop working groups, which is where groups come together to focus on a particular focus area that they're interested in with regards to supporting children. And we're just continuing to learn through the learnings from the NHC to implement more changes to benefit partner networks and increase our impact. So if we're thinking about praying for the NHC, the Network Health Check, please do pray for 3 new networks that have started. Red Viva One Child, which is in the Dominican Republic, Red Viva Jungchitan, which is in Mexico, and Reach Pune Network, which is in India. Please also, we need to pray for the drop in the reach of child protection training and wisdom as why this is the case and what action we can take. And so please do pray for those child protection trainings that we've kind of put online. And please pray for the planning for next year's NHC and the changes that are being implemented to help to get better data. So the changes are focusing on making the survey easier for the networks to fill in and also making their individual reports more useful for them. But also we can praise God because we've got an amazing team of staff and volunteers around the world who've made all these programs happen. So please do pray also for the 3 million children who are reached, that they may continue to be encouraged by their encounter with Viva partner networks. Thank you very much.